I would like also to mention that the National Alliance for Healthcare Purchases Coalition had published an action brief. I believe this was in July 2018, and it was specifically about the value of biosimilars and improving treatment access and lowering costs nationwide. And in that document, there were 4 action steps for employers. In this document that I mentioned from the National Alliance, the action steps for employers, the first one is to quantify the biosimilar opportunity by initiating conversations within vendors such as the health plans, the pharmacy benefit managers, also known as PBM, and the specialty pharmacy provider. This discussion will help initiate a better understanding on the fill rates, the potential savings from utilizing biologicals versus biosimilars, and the also the availability for the biosimilars to the members covered under the plan. Part of step 1, as I mentioned, was to have that understanding of fill rates and saving potential, and I would recommend the employer starts with talking to their account manager, executive account manager for their PBM vendor. Also discuss this if the employer has a pharmacy benefit consultant, that would be another resource for the employer to go and have these detailed discussions. These can differ between states, regions, and different industries. So I think that it's a very important conversation to be had on specifics and on case-by-case basis. Another resource to talk about these things, if the employer belongs to any of the employers' coalitions or employer healthcare purchase coalitions, and that would be another resource for employers to reach out and have these discussions and talk to the folks on those teams to assist with a better understanding. Part of that step 1 is to have a better understanding on the opportunities and how they vary between different employers who are self-insured and self-pay versus employers who are commercially insured, because these health plans are handled in a very different manner, and employers who have self-insured may have a lot more control on the benefit design and what is covered under their formulary and how to make it available to their lives covered, versus the employers who are not self-insured and they have commercial insurance may not have as much ability to make changes to the plan.